Hi.
Hi.
My name is Sharice Mashishka. I'm going to be your student nurse practitioner today. I am going to be performing your neurological assessment and your musculoskeletal assessment. Can you tell me your name?
Rick Mashishka.
And what is your date of birth?
8/15/81.
All right, so I am going to close the door for privacy. I'm going to wash my hands. So right now I'm just going to test like your alert, or your alert, but your orientation. So I'm going to ask you a couple silly questions. Do you know what year it is?
2022.
And who is the president?
Joe Biden.
And do you know what we're doing here today?
You are going to give a student assessment for
Okay.
your class.
All right. So I'm looking, you are alert and oriented times for your alert to person, place, time, and situation. I'm inspecting your affect is appropriate, you're dressed appropriately, and everything looks good neurological wise. So now I'm going to move on and I'm going to test your cranial nerves. There are 12 cranial nerves. So I'm going to ask you to close your eyes for this first one. This is your olfactory. And I'm going to wave a scent under your nose, and I want to see if you can tell me what scent that is. Can you smell that?
Alcohol.
Yep. You can open your eyes. It's an alcohol prep pad. So your cranial nerve number 1 is intact. So now for cranial nerve number 2, this is your optic nerve. I'm going to ask you to look at this Snellen chart that my assistant over there is going to hold up. I'm going to ask you to cover one eye.
Which eye?
Whichever eye. We're going to do both, so whichever one. And what is the smallest line that you can read comfortably?
The third one down from the top.
So what line is that?
FPH?
FPH, good. And then so that is your left eye. And then what, can you cover your left eye now? And what's the one with the right?
ELT? FPH?
FPH, okay. So your vision actually is 20/70. So do you wear glasses or contacts?
For reading.
For reading.
Close up.
When was your last eye doctor's appointment?
I don't know.
We might want to get that vision checked. So I am also now going to have you look at me. I'm going to have you cover your eye, or one of your eyes, and then I'm going to cover my eye, and we're going to check your visual fields. So which eye are you going to cover? I'm also going to cover my left eye, and I'm going to bring fingers in. You let me know when you see them.
No.
No?
From the start. From the start. From the start. No. No.
No? Okay. All right, so your peripheral vision is intact. So that is your cranial nerve number 2. So now I'm going to check cranial nerve 3, 4, and 6. So I know you have sensitive eyes, but I got to shine a light into your eyes. So I'm going to open this one, help you open it up, and I'm going to go in, checking to see if it constricts. Good. All right, give you a minute. And now I'm going to ask you to look at my pen light. And then just follow it into your nose.
You messed up my eyes, young lady.
Yeah, you have
All right, go
sensitive
ahead.
eyes. All right, you're just going to follow this pen light as it comes closer to your nose. Okay. All right. So you have some sensitive eyes.
Mm-hmm.
All right.
Mm-hmm.
So I've checked cranial nerve number 1, cranial nerve number 2, cranial nerve number 3, 4, and 6. I'm also going to check your 6 fields of gaze. So follow my finger with just your eyes. Okay. Okay. All right, we might want to make an eye doctor's appointment there. But there is no ptosis, there's no nystagmus, there's no twitching, but you just have very sensitive eyes.
Mm-hmm.
All right, so those are all your your eye nerve. So now I'm going to move on to cranial nerve number 5. Can you clench your jaw for me? And I'm just making sure I'm feeling the muscles there and the muscles temporal. All right. And now for cranial nerve number 7, can you smile, frown, raise your eyebrows, puff out your cheeks, close your eyes real tight. I'm going to try to open your eyes. Don't open them. Okay. Very good. So those are checking all your facial nerves. So for cranial nerve number 8, I need you, that is your acoustic. So I'm going to occlude one eye and then I'm going to whisper a word and I'm going to see if you can hear it.
Green apple. Cleveland Browns.
Okay, so that's cranial nerve number 8. Your acoustic hearing, that is intact. Cranial nerve number 9 and 10, I'm going to ask you to open your mouth and say ah. Good. I'm looking at your uvula, making sure it's midline and symmetrical, and your soft palate, everything is symmetrical there. And then I am going to have you push against my hand. Good. Turn against my hand. Can you lift up against my shoulders? Good. And then I'm just going to have you stick out your tongue and sway it side to side. All right, so that's nice and midline, even and symmetrical. So now I'd like to evaluate your fine motor skills. This is your rapid movement. Can you do this as fast as you can? How about this hand? Okay, that's nice. Now I'm going to stick my finger out. You are going to, with your finger, touch my finger, touch your nose as fast as you can. Okay. All right, very good. So now, also, can you take your heel and rub it up your shin? Good. All right. Now I'm going to have you stand up. I'm going to have you stand with your feet together, arms down at your side, eyes closed. This is the Romberg test. Some swing is a little normal, but you should not fall. Good. All right. And now to observe your gait, I'm going to have you walk to the cabinet, and then on your way back, please walk heel to toe. Walk normal. All right, have a seat. All right, so now I have a cotton applicator that I split in half.
Don't put that in my eye.
I will not put this in your eye. So right now, this is going to be dull. This is going to be sharp. So I'm going to have you close your eyes and I'm going to touch you in different areas. You are going to let me know if it's dull or if it's sharp. Do you mind closing your eyes?
Dull. Sharp. Dull. Sharp.
That was dull.
Dull.
Okay.
Dull.
Dull.
Do it again. Dull.
Dull. Good.
Sharp. Sharp. Dull. Dull. Sharp. Sharp. Dull. Dull.
Good.
Hold on. Put my feet down. Dull. Dull.
Those two.
Sharp.
Sharp. Good. All right. So that's that. I hate to do this to you, but I need you to stick out your tongue. I just need to check your gag reflex. All right, so that lets me know that you can chew and swallow without having to gag. I am going to have you close your eyes again. I'm going to place an object in your hand, and I'm going to ask you to feel it so you can tell me what that is.
It's a coin.
Good. It's a coin. I am going to draw a number on your hand with your eyes closed, and you're going to let me know if you can feel it.
3.
3. Now I'm going to check your 2 point. Keep your eyes closed. This is going to be 1 point. This will be 2 point. You're going to let me know how you feel this. Ready?
1, 2, 1, 2.
Other hand.
1, 2, 2, 2, 1.
Good. And now while I have your eyes closed, I'm going to take your thumb, and you're going to let me know if I'm moving it up, down, and let me know how that. Ready?
Up, down, up, up, down, up, down, down, down.
Good. Okay. Now I need to check some of your reflexes. This is one that I'm still working on. So I'm going to check your bicep reflex. So if you can make a fist for me. There was that tendon right there. All right, relax down. Arm, I'm going to give it a good. All right, I'll work on that one. For the sake of time, I'm going to check this one. All right, and then back here. So just kind of loosen that up.
Mm-hmm.
All right, there should be reflexes there, but I'm working on these.
Maybe I'm dead.
I'm going to check this one. All right. And then I'm going to, if you can kind of relax your legs.
Cross them?
No, I'm going to do the patellar one that I was trying last night.
Put it over your leg.
No, whatever.
Yeah? Come on, slide in. So it's behind my knee. Look at that.
There we
See?
go.
I'll
Okay.
teach you to be a nurse.
So it's right below the kneecap. Oh! I got
Look.
Let's try together. A little bit?
Mm-hmm.
A little bit? Okay. All right. And then there's also one, for the sake of time, there's also one behind the Achilles that I could check. But I think that is it for now. So I also would like to check your musculoskeletal. So I'm inspecting, so I'm looking for symmetry of your arms, symmetry of your legs. I'm looking to see if I notice any obvious deformities, any masses, any nodules. So I'm inspecting and I don't see. I'm actually going to start with your TMJ, meaning open and close. Can you move your jaw like left to right? How about in and out? Like buck? Yeah. All right. I palpated that. I don't feel any clicking or any crepiness. Do you have any pain or tenderness with that? How about your neck? I'm going to, can you touch your chin to your and back? And turn to the right. Turn to the left. And can you put your ear to your shoulder? Other ear to your shoulder. How about any pain there?
I have a herniated disc. There's
so
almost
there
always
is
pain.
some pain. Okay. All right. And now for your shoulders, can you lift up, down? Bring your arms up, back behind your head. Bring it back out, around. Can you go behind your back? And good. All right. Any pain, clicking, or anything like that?
Nope.
Okay. And you can sit down for this part too. Elbows. You can go out. Can you flip your hands? Any pain?
Nope.
So your wrists, can you move your wrists, circles? Fingers open. All right, and I'm just gonna palpate. There's a lot of bones. I'm looking for deformities. See if you have any arthritis. No clicking. And that looks good. So if you can stand up for me, I'm gonna check your hips. Can you go to the right? Left? Back? Good. Did we do a twisting? Can you twist? Okay. And while I have you standing, I do need to look at your back. I'm looking at your neck and your spine. I'm palpating down. I'm looking for anything like you do have a herniated disc, but I don't see any kyphosis or lordosis. All right, that looks good. Are you able to bend and touch your toes? Okay. All right, and that's for your hips. And if you can sit down again. How about your knees? Any knees? Can you out? Out? Can you go to the side? Side? Ankles? Rotate? Rotate? Toes, you can. Good. Palpating. Inspecting. Okay, and there's just one thing I have to do. I'm going to check what is called the Babinski's reflex. You might be ticklish. A normal response will either be no response or for your toes to curl down. An abnormal response will be if your toes flare open. So, I'll come over here. I'm Esther. Okay. All right. And then I'm going to start at the bottom. Okay. All right. Did you have any pain, any tenderness, anything while we were doing any of those range of motion exercises?
No, ma'am.
All right. Everything looks normal and intact. I do want you to make an eye doctor's appointment, get that vision checked out. Do you have any questions for me?
Nope.
Okay. Thank you and have a nice day.
You too.